I am Dr. Thompson Akwo Ntuba, international political leader, physician and communicator, certified professional and expert in global health, USA. Global health updates, environmental health and safety. Environmental health and safety. For some time now, I've been discussing and giving talks and workshops, seminars. I've been to seminaries, universities, and colleges around the world. I've spoken to meetings, I've spoken to colleagues and friends in Europe, in America, in Africa, multiple countries on the subject matter for which I am certified as an expert. But right inside global health, I subspecialize in global health communication and global health promotion. And if you go to Health Consulting International, you will actually see written Dr. Thompson Akwo Ntuba, international speaker and consultant, changing communities or societies and behaviors through communication. So there are many of you who are asking, what types of communication? The communication method is the global health and medical communication, what we call medcoms. Part of our work in global health is the effect of the environment on humans. We've been talking about climate change and all the other related things. But basically, as I said, the environment and environmental health is part of our training in medical school. Under global community health, it's part of our training to become certified experts and professionals in global health. So we would always like people to know that their environment, whether it's built environment, whether it's the environment or inbuilt environment, which is their workspace. Because for some of you, your work environment is outside. For some of you, your work environment is inbuilt. We in global health are interested in the different environments under which people spend time and how the conditions in those environments are affecting their health. So when we talk about environmental health, we are looking at the health of humans in their relationship to their ecosystems or their environment. And as I said, environments can be inbuilt or outside environment. You would agree with me that for certain people who have practiced pediatrics, some of the issues that we look at is lead poisoning in children, which is coming from paint and related things. So we have environmental hazards. We have environmental pollution. Water is part of our environment. Waste management is part of it. The air that we breathe is very, very important. A good example is the city of Houston. It's known as the capital, the energy capital of the world. Those who say that enjoy the childishness of bragging all over the place, whatever that means. But if we claim that a city is the energy capital of the world, then we get to understand that that city is related to lots of oil and gas, energy production companies and activities, chemicals, and all sorts of things. There was a chemical plant that was burning and burning and burning some chemical and exuding all these fumes and gaseous substances or chemicals into the air. Well, some of those things, the air quality is the job of the cities and the healthy cities and communities. We look at that. It's the job of the cities to make sure that the health, the air that the denizens or the residents of the city breathe is not harmful or injurious to them. There are many people who come up with certain cancers because they are exposed to carcinogens, which are products from different types of company activities within their environment. There is also the need for people to know that waste can have injurious effects on humans within certain populations if they are not properly disposed, if they are not properly taken care of, whether we have water waste or solid waste, So residues, waste from human activities may be injurious to human health, as we have been taught in global health teachings, in global community health. And some of you, if you go to very good medical schools, community health and public health and population health will be part of your curriculum, so that at least you have an introduction to environmental health and related what we call environmental safety. Occasionally people want to talk about occupational health, but all of that can be addressed under environmental health and safety, because occupations actually take place within environments. I don't know who does anything which is outside of certain environments, be they outdoor environments or indoor environments, and all of that is related to the environment. The solid waste can be addressed. I've talked about noise, radiation. We know that the people of Japan have had some situations which are unnecessary. Now, one of the things that certain radiations do is they are called carcinogens on their own. They have the ability to change, to lead to DNA and genetic mutations and changes of their own. There are many people who come up with certain cancers because they have a history of having been inappropriately and or excessively exposed to certain radiations, be the X-rays. For some, it is just solar radiation and all of that has led to skin cancers and related stuff. So radiation of its own can be injurious, can lead to health problems, and that is related to environmental health. Then hazardous waste. There are lots of people, especially there was a history of people bringing certain waste from overseas and bringing them to parts of Nigeria to dump. And those things were polluting the place, creating certain radiations that were noxious to human body. For others, it is water. For many people, the source of their drinking water may be just some open water somewhere. And in that same water, there are people who go pass out feces and urinate and wash clothes in there. And so all of that is done upstream, and you is downstream. I'm not talking about upstream and midstream and downstream in oil and gas production. I'm talking about the flow of rivers and waters from which people may be, getting their sustenance. The pollution of the water and the environment, itself can lead to problems. So I talk about water and air pollution, noise. For many people, it's the noise, and they come up with certain ear problems and related things. Some people, they just get anxious, with all of that unnecessary noise within their environment that they may have wanted to control, but on their own, they cannot control. So we see that there are environmental pollution or pollutants and waste that should be of concern to us. Besides those environmental pollutants and waste and related things have an impact on human health and through the environment, whether they are chemical toxins or toxic chemicals, whether they are physical hazards, like I talked about rays in the air. There could be ultraviolet rays. There could be lead. I talk about lead poisoning, pesticides, people who use fertilizers on crops and things like that. Physical hazards, and there could be those I've talked about. And then just being in the environment, there may be lots of psychosocial issues, Those psychosocial issues on their own, they constitute hazards, right? And that affect human health. For others, there are sociological issues that are related to hazards. We have a lot of places where, because of growth, extensive urbanization, related social issues and migrants and all the fights and all of those things, because the environment and maybe the community doesn't have enough space for a lot of new growths and population, so they are creating their own problems. Some of the things that we are very concerned now is climate change, global warming, and those are not, they may be part of some of what we call the natural disasters, that are affecting health, the hurricanes and bushfires and all the other natural disasters, which are complicating climate change and global warming are a problem. So as the world is going to Glasgow at the end of this month to deliberate on some of these environmental issues and their impact on human health, we know that the biological elements are there. We have talked about water-based, waterborne, water-associated, water-related diseases, and whether they are foodborne diseases, vector-borne diseases, when there is excessive flooding in places and then there is swamping, the water accumulates, and we have all these malaria, plasmodium parasites that begin to grow, and they become the vector for the transmission of malaria. So some of the environmental problems that we have are related to these issues. We've dealt with violence within certain communities and injuries, and related things, which are factors related to certain environments, right? There are some places that they say, if you go to this community, you can easily lose your life over there because violence in that community is more. The people in the community, in that environment are like this, are like that. So the conditions are there. Then again, as I said, occupations are done within environments. The environments can be inbuilt or outside. So I can tell you some of the meetings that we've had around the United States in different states and cities and counties. And, we've been part of the green festivals and the environmental and climate and green sustainability issues which are discussed there. We've been part of the Green Build that is looking at sustainability, these environmental issues and how we can adapt properly, within our environments, our communities, and take care of some of these hazards which are related to the air, to the water, to the food, to our waste, whether they are solid waste or things like that, the pollutants in the air and related things. Some of those things that people need to really take care of based on their occupations, right? There are some people who they're exposed to asbestos by measure of the type of job they do. There are some people who are exposed to excessive ultraviolet light because of the nature of their job. There are some people who are exposed to X-rays, in hospitals as side effects of their working in the radiology department or other places, and these safety issues, occupational health safety issues have not been addressed. So the safety and health in our workplaces are also very, very important. I've been invited to CERAWeek, which is one of the biggest oil and gas energy conference and meetings in the world, with presidents and prime ministers and, name them, coming from all the different continents to attend. So these are very big meetings, and in there we have looked at the safety issues related to workers and personnel in oil and gas and energy companies and related areas. So even injuries in the workplace, I have been part of upstream conferences in oil and gas. I've been part of midstream conferences, downstream, NIP, offshore technology conference, or what they call the OTC. And in these conferences, and recently we had the VAVs, we've discussed some of those